So what if you're just one person who's passionate about improving mental health outcomes, but you don't have an action team to help you make it happen? How are you supposed to make a difference across a community and create a community approach to mental health? Well, I'm here to tell you today that I was that person. I came from a place where I was really frustrated that my students weren't getting the answers that they clearly needed with their mental health. And it just seemed so obvious to me that things could be done so much better. But the thing is that there's very little room, if any, in government sectors to find time to collaborate. I certainly know, working in education, that I never had a moment to take a breath. And our nurses and our police are in just a similar situation. But the thing is that collaboration is 100% what needs to happen. There are so many of us that are frustrated that common sense solutions just aren't being utilised in our roles. And there are so many limitations that hold us back from actually creating solutions that can truly work for our students, for our clients, for our community members. So if we think, for example, for a moment, that a student or client might need help, but there aren't services to provide it locally. So while we can recommend they go and seek help, there just isn't the services to provide it. It might be that the access to support is limited for a variety of reasons, such as being able to get there via transport, and lots of other things that can come into play. And so what ends up happening is that another child or a person goes without the help they so desperately need. But I want to tell you that there are solutions that are waiting to be found. The thing is that the passion that lies in you for improving mental health outcomes is what is going to make the difference, regardless of whether or not you're a mental health professional or not. And that passion for improvement is absolutely what made the difference for me. It's what spurred me on to make a change and to create a new way of thinking about this and a new way of collaborating across the sectors. The thing is that it can be as simple as just starting a ripple of change that hasn't been considered before. It might be that you make contact with other individuals who you know share a passion for improving mental health, or who share a frustration in not being able to get the outcomes that they're hoping for. Now, I just want to stop there for a second, because you might be thinking, Renee, you're crazy. I don't know anyone. You say go and talk to people that are also passionate, but I feel like I'm on my own and I don't know who these other people are. Well, the thing is that it might be as simple as emailing the local doctors or the mental health professionals and just asking who the best person to chat to is around mental health initiatives and support in the area, to start to get a gauge for the people that are working in that field. It might be a matter of emailing the local police department and asking who the best person to talk to is about community, organising things for the community and organising things that create a sense of belonging, and build relationships. And slowly you will start to identify people who also share your frustrations. Now, if you can get 4 to 6 passionate people, including yourself, together, you've got the start of something amazing. You've got the start of a community mental health action team, or as I like to call it, a CoMHAT. And from there, incredible, amazing things can grow, because it's the strengths that exist already out there in our government sectors, out in our communities, out in our sporting and community groups, that actually create the ability to start making things grow. So look, I'm going to stop there because I could talk about this forever. But if you want to learn more about how to use your passion, either individually or collectively, because you already have a team, to create improved mental health outcomes, please click on the link in the comments or the video below. And not only will you be able to learn more about all the things that you can do to create change and to create traction, but you'll also get access to a free community mental health checklist that I've made, which is a really comprehensive process of all the steps involved from start to finish that you would be utilising if looking to develop a community mental health approach. Now, I just want to mention that if the idea of all of that really scares you and that's not something that you feel confident in, but you are an advocate for change, just know that you don't have to be the one doing it. You might be the person who advocates for sharing this with other people who might be those people. You might share it with someone else you know who's passionate about this. You might share it with a community group or a local government representative that you know, because you want to be part of creating that change, but maybe you don't feel confident about being the person to do that. But look, I want to tell you, the thing is that we can change the statistics and we can start saving people's lives. It all starts with you, and it all starts with taking either your passion and driving change or taking your passion and sharing it with others to let them know the potential of what can be achieved. So until next time, I'll talk to you later.